Hey there, welcome back to the channel where we break down the complexities of medications. Today we're shining a spotlight on Lisinopril, a medication with a substantial impact on cardiovascular health. So, whether you're already familiar with it or just curious, buckle up for a deep dive into the benefits and potential side effects of Lisinopril. Please note, the information here is for education purposes only. For more information, contact your doctor or pharmacist for specific details. Our first point of interest is brand names. Lisinopril is commonly known by several brand names, including Prinivil and Zestril, among others. These brands are well recognized in the pharmaceutical industry and have been trusted by millions of people worldwide. They are synonymous with quality, efficacy, and safety, providing reassurance to those who use them. Moving on to common generic name, Lisinopril is the generic name for the drug. This name is universally recognized by healthcare professionals and is used in medical literature and prescriptions. It's a name that carries weight and is respected in the medical community, signifying a drug that has proven its worth time and time again. Our third stop is FDA Approved Uses. Lisinopril is FDA approved for treating high blood pressure, heart failure, and improving survival after heart attacks. It has demonstrated significant success in these areas, leading to its widespread use and popularity among healthcare providers. Its effective results have made it a go-to medication for these conditions. Next, we explore how it works, or its mechanism of action. Lisinopril is an ACE inhibitor that works by relaxing blood vessels, allowing blood to flow more easily, which helps lower blood pressure and makes the heart's job easier. It's an ingenious mechanism that showcases the marvels of modern medicine. Let's discuss common side effects found with Lisinopril. Like all medication, Lisinopril does have side effects. These can include dizziness, lightheadedness, tiredness, or headache as your body adjusts to the medication. These side effects are usually mild and temporary, but it's important to be aware of them. Moving on to rare but serious side effects, these include fainting, symptoms of a high potassium blood level, and serious allergic reactions. These are unlikely, but if they do occur, they require immediate medical attention. Knowledge of these potential effects is crucial for safe usage. The good news is, there are strategies to minimize potential side effects. Staying well hydrated can help with dizziness, and if you notice any persistent issues, always communicate with your healthcare provider. Remember, you're a team working towards your health goals. Drink plenty of water, avoid alcohol, and standing up slowly can help reduce the side effects of Lisinopril. It's about making small but significant lifestyle changes that can help make the medication more effective and comfortable to use. Before we continue, please, if you're finding these videos informative and helpful, don't forget to smash the like and subscribe buttons. By subscribing, you'll be the first to know when we release new videos, keeping you updated with the latest information about various medications and health-related topics. Thank you. Now let's move on to the next topic, potential drug, food, and disease interactions. Our next topic is potential drug, food, and disease interactions. Certain drugs, food, and diseases can interact with Lisinopril. These include potassium supplements, salt substitutes, and kidney disease. It's essential to consult with your healthcare provider about potential interactions. Exploring who should avoid Lisinopril, those with a history of angioedema, pregnant women, and those with bilateral renal artery stenosis should avoid taking Lisinopril. It's about knowing when the risks outweigh the benefits, and this is one such scenario. Discussing allergy considerations, individuals allergic to any ingredient in Lisinopril should avoid taking it. Allergic reactions can range from mild to severe, so it's always better to be safe than sorry. Next, we look at use in pregnancy and breastfeeding. Lisinopril is not recommended during pregnancy or breastfeeding due to potential risk to the baby. It's one of those medications where the potential risks far outweigh the benefits in these specific scenarios. Now let's explore the off-label uses of this wonder drug. While Lisinopril is primarily prescribed for hypertension and heart failure, there has been some exploration of off-label uses based on its effects on the cardiovascular system. It's important to note that using any medication off-label should only be done under the guidance and supervision of a healthcare professional. Here are 3 off-label uses of Lisinopril that have been considered. 1. Migraine prevention. 2. Diabetic nephropathy. 3. Prevention of the progression of aortic aneurysm. It's crucial to emphasize that using Lisinopril or any medication for off-label purposes should be done under the supervision of a healthcare professional. Lastly, we delve into studies that support its use. Multiple studies have proven Lisinopril to be effective in treating high blood pressure, heart failure, and enhancing survival rates post-heart attacks. Among many, a key study titled, Effects of Lisinopril on Mortality and Morbidity in Patients with Heart Failure, a randomized double-blind comparison with placebo, the ATLAS study, published in the Journal of the American College of Cardiology, stands out. This study found that high-dose lisinopril significantly reduced the risk of both death and hospitalization for heart failure when compared to low-dose lisinopril or placebo. The findings of this study have further bolstered the case for using lisinopril in treating heart failure. It's a medication that has withstood the test of time and rigorous scientific examination. To recap, lisinopril, known by brand names such as Prinivil and Zestril, is a widely used medication for high blood pressure, heart failure, and post-heart attack recovery. It works by relaxing blood vessels, but it does have side effects, some of which can be serious. It interacts with certain drugs and diseases, and should be avoided by certain individuals. Despite its side effects, lisinopril has proven to be a valuable tool in the medical arsenal, backed by numerous studies and off-label uses. That's all for today's video on lisinopril. We hope you found this information helpful, and it has provided you with a better understanding of this common medication. If you did find this video beneficial, please don't forget to hit the like button and share it with your friends and family who may also benefit from this information. Your support helps us to continue creating these informative videos, so we encourage you to subscribe to our channel if you haven't already. This way, you won't miss out on any of our future content that could be valuable to you. Remember, everyone's medical situation is unique, so always consult with a healthcare professional before making any changes to your medication routine. Thank you for watching and stay tuned for more informative videos. Be well and stay informed.